Hello, my name is Georgia Boyd-Matic, and today I will be discussing the informational interview I had with a real-life respiratory therapist. I interviewed Kimberly Group, who is a respiratory therapist that got her associate's degree in respiratory care from Harrisburg Area Community College. She also has her bachelor's degree in applied sciences with a minor in healthcare management from Siena Heights University. Lastly, she obtained her master's from Messiah College in strategic leadership. She is a registered respiratory therapist and a neonatal pediatric specialist. She has her BLS, ACLS, PALS, NRP instructor status certifications. Kim is a staff respiratory therapist at Penn State Health, where she was also the education coordinator, pediatric clinical specialist, ECMO specialist, and the NICU-PICU core group specialist. Kim has also had some of her work published. Penn State Health's mission is to continually improve the health and well-being of the people of Pennsylvania and beyond. Their vision is to be Pennsylvania's most trusted healthcare organization by delivering excellent care, ensuring the availability of affordable, appropriate, and comprehensive localized care by integrating it in an extensive community-based provider network, cultivating a professionally fulfilling environment for their caregivers, educators, innovators, researchers, and staff, and advancing the science of medicine by disseminating knowledge to the world. Kim got interested in respiratory care because her grandmother fell ill due to COPD and was intubated. Kim took over her grandmother's care and thought that respiratory would be interesting. She worked as a float respiratory therapist, which means she worked everywhere in the hospital, but mainly in the ER. She participates in resuscitations, treats heart attacks, works on COVID, BiPAP, and intubated patients, knows how to use high-flow nasal cannulas, and cares for trach patients. Some essential attributes for the job are giving mutual respect, being confident while talking to physicians, being willing to offer suggestions, and having great communication skills. So Kim was an educator at Hershey, where she educated about 140 people, working 80 hours a week. She didn't have children before accepting the position, but when she did have children, her son had medical issues, so she had to give up her role as educator to care for her son. She likes how with healthcare, you're able to roll with whatever life throws at you. She's now able to see her children grow up and was able to manage a work-life balance. Some current issues and trends in the medical field are obviously COVID, and with that come mandatory vaccinations. There are many providers that are against it, and there's already a large vacancy rate, so Kim's thinking that there will only be an increase and have more of a staffing shortage. But Kim feels like COVID can help us be prepared for more infectious diseases in the future. So Kim was interviewed with the assistant manager at the time at Penn State Hershey and was asked a variety of clinical questions. When she applied to be the clinical specialist, she interviewed with staff, other members of leadership, and nursing. Now that she's part of the interview process, they have 10 people in a room with an applicant and are asked clinical and personality questions. They then take the applicant around to see if the Hershey lifestyle is for them. Kim says that there's a lot of great opportunities at Hershey, and they give a lot of educational and research opportunities, but you must seek these out for yourself. Hershey is a very large institution with 140 employees, and many of them feel like they are just a number, and the manager doesn't even know everyone's name. So they must be able to seek out these opportunities because it's very hard for the manager to organize and maintain all of their staff. Kim has had a lot of managerial turnover since she started working there, so she's on her 8th or 9th supervisor. There's also been a lot of employee turnover because a lot of them just apply for the experience and then leave to go travel because employees feel comfortable since they've had the experience working in a big hospital. When Kim became an educator, she only had her associate's degree, but then went back to school to obtain her bachelor's and master's degree. She had employees to educate on all different shifts, so she wanted to try and make the training available to everyone. It took about 6 months for everyone to get trained on one topic because she had to educate the respiratory therapist, nursing, and physicians. She also had to get buy-ins from all of the stakeholders. In order to do all of this, she used a checklist describing what the product was, who the stakeholders were, who she had to educate, goals she would set for herself, and a timeline. In order to determine the education curriculum, she needed to do a needs assessment. She would send surveys to employees or directly ask for feedback for what they would like to be trained on. She made sure to make a checklist of the process or procedure with the indications and contraindications. Kim had to make sure that she provided a different needs assessment for different multidisciplinary teams. For example, nursing has different goals compared to respiratory. Kim used a lot of simulations for the hands-on experience because she wanted experimental practice. She would then talk to employees after the training to give them feedback on their performance. The trainings were not on any specific schedule and were mostly on an as-needed basis, but Hershey was always getting new equipment, so she would have to conduct trainings pretty frequently. They would educate on low volume, high acuity every year. They would focus on topics employees could learn from, like close calls, never events, and had after-action reviews. The employees would be given a checklist for their training that they had to complete, and they would talk through the scenario with Kim, where she would give post-assessment questions. She said that it's difficult to evaluate the knowledge of people in the medical field because she can only assess the basic procedures. Although all patients are different with different symptoms, so she would try and base the questions off real patient care that the employees may come across. She would then follow up with employees to ask if they feel like their skills are adequate to give them the confidence to perform it in real life. Kim valued and wanted one of her employees' feedback and wanted to know how the employees evaluated the curriculum and her, because she wanted to ensure that she was teaching her colleagues effectively. She was always looking for areas to improve and found that she got the most candid feedback from the negative Nellies in the group, but she had to be willing to accept the criticism because she wanted to change and do better for the future. Kim has advice for those entering the medical field, and that's to be a team player because at the end of the day, the patient suffers, and to also treat people how you would like to be treated. If Kim could do it all over again, she would only change a few things. She loves respiratory and medicine, but wishes that she would have gone to PA school. But she loves the life with her children that she has now and loves educating, but wishes that she would have experienced this later in life because she feels like she peaked early. So sometimes she feels stagnant right now. So frequent training is important and crucial for an organizational success, especially in the hospital setting. It sets the organization up with higher profit rates, more customers, happier, satisfied customers, less mistakes, less potential lawsuits, and overall improvement in business performance. So companies invest in training with the expectation that competitiveness will increase through improved results. The training is focused on individual performance that should lead to enhanced skills, greater ability to adapt and innovate, better self-management, and performance improvement. So there are hopes that there will be lower employee turnover, improvements in effectiveness and productivity, more profitability and reduced costs, improved quality and customer service, and increased human capital. If the employees are not continually trained, they may fall behind and the company could become less competitive and legally compliant. Without ongoing training in the workplace, organizations may not have staff members with the KSAs needed to compete effectively. Knowledge management is the way an organization identifies and leverages knowledge to be competitive. Learning culture is a work environment that encourages employees to share their individual knowledge, skills, and experiences with their coworkers. A learning culture can be created through getting top leadership support for a learning culture, involving middle managers with developmental implementation, focus on how KSAs can be improved, emphasizing the importance of learning to all members of the organization, developing and utilizing learning programs to crystallize the culture, and relying on measurement and assessment to determine how learning might be improved moving forward. Job performance, training, and employee learning must be integrated to be effective. Organizations find that training experiences that use real business problems to advance employee learning are better than approaches that do not. And trainers can incorporate everyday business issues as learning examples, thus increasing the realism of training exercises and scenarios. The instructional systems design is a step-by-step process to ensure that the right learning materials are provided to the right people at the right time, and the ADDIE framework is used with this. ADDIE stands for Assessment, Design, Development, Implementation or Delivery, and Evaluation. To make a training needs assessment, the assessment should include issues related to employee and organizational performance to determine if the training can help. It'll measure the competencies of a company group or an individual, and identifying gaps in the performance is key to the assessment process. We need to consider if there's a need for training, who will be trained, who will do the training, what form will the training take, how will knowledge be transferred to the job, and how will the training be evaluated. Two different instructional strategies are practice feedback and behavioral modeling. So practice feedback, we have active practice, and that occurs when trainees perform job-related tasks and duties during training. This is similar to what Kim did with real hands-on experience. Behavioral modeling is copying someone else's behavior and is particularly appropriate for technical skills training, in which the trainees must use both knowledge and practice, and can aid the transfer of skills and use of those skills by those who are trained. There are different levels of evaluation, which are reaction, learning, behaviors, and results. Kim mainly focused on behaviors, where she was measuring the effect of training on job performance through observing workers on the job. So thinking for the future, I do hope to become a manager one day and will rely on the strategies learned to construct a proper training for my future employees. I know that proper training develops quality employees with proper KSAs that will give us a competitive edge. Thank you and have a great day.